Welcome to the video series for the Commission's Foundational Report on Racism in Nursing. We welcome your exploration of this topic with the hope that it will bring to light a serious problem within the nursing profession that impacts our colleagues and the patients and communities for which we care. I'm Deborah Washington, and I was part of the group that wrote the report on practice. The idea that racism exists in nursing practice is disheartening, yes, but that acknowledgement is also a call to action. The report from the National Commission to Address Racism in Nursing is our profession's national response to that call. It's a map for the way forward. Here's what we face if we are to dislodge racism as unwanted in who we are as a discipline. We must address it because racism creates vulnerability to a going through the motions quality of care, and it leaves emotional wounds. First, we must be able to see it. That's the primary reason we want a more diverse nursing profession. For me, as a Black nurse, I believe failure to notice results in failure to act. At this point in time, what has been researched and documented is the realization that healthcare professionals are not immune to the issue of racism. Nurses grow up, live, are socialized, educated, and practice in a society where the big picture of us as a country is a well-documented history of discomfort with social identities that are not our own. We use different words now to describe the dysfunction resulting from that uneasiness. Systemic and structural racism, the need for social justice, inequities and disparities, unequal treatment, social determinants of health, incivility in the workplace. While the larger society has its work to do uptaking this vocabulary in the world of policy, so too does each healthcare organization that must use its agency to create work cultures and clinical practices that deconstruct the ripple effect of racism in patient care. The Commission's report points out that this requires education focused on understanding elements of racism, such as race-based microaggressions in interpersonal relationships, academic courage, and creating meaningful content that promotes awareness, clearly defined calls for accountability, and leadership integrity operationalized to effect change. This assessment of racism in nursing identifies the dual harms of racism as a preventable trauma. It impacts colleagueship and undermines the role of nursing as trusted messenger to marginalized populations. Most important of all, the Commission report offers recommendations that can inspire DEI initiatives to a step-by-step transformation of an invested organization. Ultimately, the vision and end goal is to make the practice of nursing incompatible with the presence of racism. This written evaluation of the issue by the Commission is a way to make that vision a reality. Read it and see what I mean.